What's up, everybody? It's Candy Girl with my 2 cents on the American Health Care Act, which is going to repeal the Affordable Care Act, better known as Obamacare, and it's going to replace it with something totally different. I'm going to talk about the good and the bad, and especially the ugly, because overall I'm against it as far as the repeal of the Affordable Care Act. So the information that I'm basing my opinions and my analysis of is the Congressional Budget Office cost estimate. The Congressional Budget Office, for those people who are not aware, it is a nonpartisan governmental agency or entity that give you some kind of understanding about how things are going to work in the greater scheme of the U.S. economy. Now, let's talk about the general rationale behind compulsory health insurance. Let's say I get into a car accident tomorrow, okay, and I don't have health insurance. What ends up happening is I get a bill in the mail that says, you owe us $250,000. Well, I don't make $250,000 in a 5-year period. What do you think that I'm going to give you today? Okay, so with that being considered, you can put me on all the payment plans in the world, but I'm not paying, and you will probably never get the full sum of money. Instead of people just being like, oh, I guess we're just going to lose that money. The nurses won't get paid. The doctors won't get paid. The pharmaceutical companies are not going to get paid. No, they're not doing that. They're going to keep paying those people. But what happens is that we take the cost that had to be absorbed because the person wasn't able to pay the bill, and they split the costs amongst all of the other patients who are able to pay. And that's called a free rider. Okay, we all hate free riders, and in this situation, you're a major free rider. Okay, so when it comes to the big picture, health care premiums would go down because there's more people to share the cost amongst. Okay, so let's talk about the good. It will reduce the federal deficit by approximately $337 billion between the years of 2017 and 2026. In addition, health insurance premiums may go up until the year 2020, but after that, premiums should go down overall on average. But how do we get to the point where now we're reducing the deficit by 337 billion people, taking away the expansion of Medicaid eligibility, and from removing the Affordable Care Act subsidies for those who can't afford health insurance but would like to purchase it, and it takes up more than 5 to 8% of their discretionary income. So for those people who would like health insurance, but realistically it's just not in their budget, the subsidies were supposed to help make it affordable. However, now the subsidies are not there anymore, and neither is the Medicaid expansion. Okay. In 2018, 14 million more people will be uninsured. Okay. By 2020, that number would rise to 21 million and then to 24 million in 2026. A lot of these people are those who only purchased health insurance because they wanted to avoid the penalty. What really surprises me about people who purchase health insurance because they want to avoid the penalty, the penalty is actually less than what the health insurance would cost over a 12-year period. So I don't know what kind of math they are or are not doing, but if you really are that pressed about not having health insurance, just pay the penalty so that you can pay into the bigger system of helping with those catastrophic events that I was mentioning earlier. So for the people who actually do buy health insurance, based upon the copay that I have to pay, plus the health insurance premiums that I have to pay, because now there are less people in the group market to spread the costs, I might as well not pay for it, and I might as well just go ahead and pay out of pocket whenever I need it, if I need it. So it's just kind of like making the whole system collapse, in my opinion. Now, by 2020, the good thing is that a lot of these average premium increases are going to be offset by grants to states through the Patient and State Stability Fund. And that's going to limit costs to insurers of enrollees with very high claims. So you have to have a really high claim, and it's going to limit the cost. Now, what is that limit? I just don't know. But also, it's going to eliminate the requirement for insurers to offer plans that cover certain percentages of the cost of covered benefits. And then there's going to be a younger mix of enrollees as well. The poor and the elderly are the ones who are going to suffer the most. Now, here's a really alarming thing, is that under the new legislation, insurers would be allowed to generally charge 5 times more for older enrollees versus younger ones. If the majority of America is white, then the majority of the people who are going to be affected are going to be the white middle class. Anywho, you guys, that's just my 2 cents. Let me know what y'all think. Please rate, comment, share, and subscribe. Until next time, you all love and bless.